Kicking things off on the health sector, the Rwanda Biomedical Center, RBC, emphasized that eradicating cervical cancer is possible, but it requires collective cooperation. One of the key challenges is that many women seek treatment at advanced stages of the disease, leading to higher mortality rates. Cervical cancer currently claims the lives of over 800 women annually in Rwanda. This was reiterated during the official launch of this cancer screening program in Goma district. Olive Nete has the report.
Cervical cancer is the most common cause of cancer-related deaths among women in Rwanda, followed by breast cancer. Medical experts say that screening this cancer is a must for every woman because it often shows symptoms at an advanced stage, which is why efforts are being made to raise awareness. Preventive screening and early treatment for those at risk of developing it, because there is a chance that it can be cured when treated at an early stage. At the official launch of the cancer screening program in Goma district, many of the residents participated in these activities, showing that they understand the importance of early diagnosis. Attending screening programs is beneficial because they allow you to know your health status and start early treatment if needed. This approach helps preventing waiting until a later stage of illness when conditions may become more severe. We came to the health center to be screened for cervical cancer and breast cancer. I willingly came because I want to know the status of my health, and if any issues are detected, I can start treatment immediately. Cancer screening activities in Goma district started this April. So far, 8,061 women and girls have been screened. 110 of them have been diagnosed with precancerous lesions of this cancer. 92 have been treated and 18 are still receiving treatment. An employee working in the Cervical Cancer Prevention Service at the Remera Health Center in Goma district says that people are increasingly understanding the importance of early diagnosis. Breast cancer and cervical cancer are severe conditions that women fear a lot. And since we started these screening services, women have been attending in a big number. So far, those who have attended screening are almost 600 women. The Ministry of Health in Rwanda, in collaboration with China and the Chinese company BGI that specializes in research, are working together in screening and treatment programs for cervical and breast cancer in Goma district. The Chinese ambassador to Rwanda, His Excellency Wang Zekun, emphasizes that this cooperation aims to enhance the well-being of the population through the healthcare initiatives.
Especially in the health industry, we cooperated to benefit the two peoples. We aided Rwanda in construction of the Masaka Hospital and Kibungo Hospital. The two hospitals served a large number of local communities. And another aspect can send the medical teams to Rwanda to help the treatment of the local people. And we are quite glad now the newcomers such as BGI are engaging more and more cooperations in this area. So we are looking forward to more cooperation and more benefit for our two peoples.
Health institutions in Rwanda are intensifying efforts to implementing screening and early treatment programs to reduce the burden of cervical cancer. Dr. Albert Tuyishime, the head of the Disease Prevention and Control Department at the Rwanda Biomedical Center, emphasizes that while the eradication of cervical cancer is possible, there are still significant challenges that need to be addressed.
The first one is around knowledge, awareness of the population, because when they are aware and they know how this is transmitted, they are able to implement preventive measures. So we are putting much effort around awareness so that we can have an improved or increased knowledge around that cervical cancer. Secondly, we are putting much effort around preventive measures such as vaccination. Human papilloma virus is preventable. We have a vaccine for it, and we started even vaccinating young girls back in 2011, and if you look at the coverages, we are above 90%. But you understand, before 2011, we have a portion of our population that is not vaccinated. So we try to educate, sensitize so that they can go for a screening, an early screening, so that the diagnosis can be posed on time, and then they can start the treatment.
In Rwanda, cervical cancer screening services are currently offered from the health center to the highest health facilities, and these services are free of charge. More than 1,200 people in Rwanda get sick every year from cervical cancer, and more than 800 people die from it. The Rwanda Biomedical Center also indicates that between 3 to 4 million women are at risk of contracting it. Additionally, screening services are barely attended since it is at a rate of 24% throughout the country. Currently, 90% of girls between the ages of 12 to 16 have been vaccinated against the human papillomavirus, which causes this cancer. Those aged above 35 years are screened and treated. Olive Nete, RTV News.